Good evening, and thank you for joining tonight's live town hall meeting hosted by Douglas County. We'd like to welcome all of you who showed up in person and the many of you joining already online and on the phone. Tonight, we're providing an update on ARPA funding, the American Rescue Plan Act. From the American Rescue Plan Act passed in 2021, Douglas County has $68.2 million to invest in shared priorities. As a board, we decided last year that funding priorities should have a legacy benefit, be forward-looking, avoid duplication, be in line with our current board priorities, and leverage partnerships. We've appreciated your feedback during our live town hall on this topic in December, along with other live town halls on more specific topics and during work sessions, as well as board business meetings. We'll get to the update and your questions very soon, but I will just mention as one commissioner that the American Rescue Plan Act is intended for recovery from the pandemic. I'm very proud of the way that this county addressed the global pandemic locally, focusing on saving lives and livelihoods. But now we're talking about, what does this American Rescue Plan Act funding look like? And again, this isn't general fund money. This is money from Congress, $68.2 million, intended to recover from that pandemic. Commissioner Teal?
Thank you so much, Abe. We have a lot of information to share this evening, and we want to make sure to get all of your questions. If you're joining us on the phone, please press *3 on your telephone keypad to ask a question. For those online, please submit your question, and our moderator will read it out loud. We will also take questions from those of you here in the room with us. Just raise your hand, and we'll bring you the mic so everyone in the room, online or on the phone, can hear your question. Initially, we also determined broad funding categories. Now, those have been explained a bit, but we'll also give you an update. Just as a preamble to this evening, I have to tell you, when we first learned of the size of the funding coming to the county in excess of $60 million, I was flabbergasted. I have to tell you, my initial comments were, well, this is ridiculous. This is going to be inflationary. And it wasn't just Douglas County getting this funding, but it was every county and Indian reservation and all of the major metropolitan areas across our country. And my concern is this will be inflationary. This will cause inflation. Well, that was over a year ago. I kind of think we've all seen that a little bit of that has come to pass. And so some of my thinking, at least, has been, we're all experiencing rougher economic times for a number of factors. We can talk about the causes later. But the bottom line is, part of the discussions we've had here in the county is, let's make use of these funds here locally. And let's use them in ways that really, quite frankly, offset the hardships that we're all experiencing now. And folks, depending on who you talk to about the economy, we may be experiencing for a period of time to come. So as that is a backdrop, we'll be introducing a lot of good information to you, I hope. And of course, we welcome all comments, and we definitely want to know what you think. Commissioner Thomas, you want to take it from there?
Thank you, Commissioner Teal. And thank you to everybody who's joining us tonight. As you may know, Congress passed the American Rescue Plan Act of 2021 to allocate stimulus funds to state, local, and tribal governments recovering from the impacts of COVID. Douglas County has bounced back quickly, thanks to our residents and business owners who have remained resilient and hardworking throughout the pandemic. As we have this $68 million to spend, my first priority has been mental health. I've been working on the mental health initiative for almost 6 years, and I'm really pleased that Laura Cinconi is seated next to me. We launched our first community response team in Douglas County 5 years ago last month, and we've saved lives. And the opportunity to invest more in our mental health initiative means we can save even more lives and make lives more productive. And so that's my number one priority. And I'll be interested to see what you all think as we move forward on this tonight. One area that has changed is related to our new health department. As we continue planning for public health services, we are finding that we have the funding we need, and we will not need to use ARPA dollars to stand up our new health department. Instead, we can invest in wildfire resources, services for our neighbors with intellectual and development disabilities, and more. We'll go into details and take your questions, so please stay tuned. Roger?
All right. Thank you, commissioners. Again, we want to get to your question tonight. To ask a question from the phone, press *3 on your telephone keypad, and you'll be transferred to an operator who will take down some basic information. Once the operator notes your information, you'll be returned to the call and can listen to the conversation until it's your turn. Since we'd like to hear from as many people as possible, we'll limit all speakers to one question, and when it's your turn, I will call out your name and ask you to repeat your question for the live audience. You can also participate online by visiting douglas.co.us/town hall and entering your question on the streaming page. Now, it's my pleasure to turn this back over to Commissioner Layden. Commissioner, go ahead.
Thanks so much, Roger. Let's start with a high-level overview. Just to reiterate, we talked a lot as a board around greatest good for the greatest number, having immediacy and impact while also avoiding duplication and efforts that would not be as beneficial from a partnership standpoint. At the beginning, we started talking about prioritizing 5 investment areas: broadband, community recovery, economic recovery, mental and behavioral health, and water and wastewater investments. Today, we know recovery is already happening, so we can invest most of our ARPA funding in forward-looking initiatives. Also, thanks to the cadence of public engagement that we have had, the mini workshops, and the comments we've received from you, our priorities now include mental health, investments for those with intellectual and developmental disabilities, community and economic investments, homelessness, water and wastewater, broadband, and wildfire suppression and mitigation. I'd like to introduce our panelists, or at least have each of them introduce themselves and maybe give a brief overview of each priority. We're going to start with Dan Avery to my left.
Thank you, Commissioner. When Congress passed the American Rescue Plan Act, it specified how the funds could be spent. ARPA funds can be used for COVID-19 mitigation and prevention, behavioral health care, aid to impacted households, businesses, industries, and nonprofits. And this category can include aid to low-income or homeless populations, increasing public sector staffing and capacity, premium pay for eligible workers, water and sewer services, and broadband. Only a portion of the funding can be used more broadly than that. For Douglas County, that amount that can be used more broadly is $18 million. I received an inquiry earlier this week about lack of funding for roads and bridges in this allocation. When we were developing these allocations, one of the considerations was that significant resources will soon be coming available from the infrastructure bill, and some of that funding can cover those topics. The funding in this ARPA allocation can't be used for tax cuts, it can't be used for debt service or financial reserves, and it also can't be used for general infrastructure. Holly, can you talk a little bit about broadband?
Thank you, Dan. My name is Holly Carroll. Technology is involved in nearly every aspect of our lives, so if you don't have access, you're at serious disadvantage. You're unable to fully participate in social and educational opportunities, the economy, or even basic health care in some cases. In order to have a better understanding geographically of where these areas exist, this year the commissioners went into a contract with HR Green, and they completed a study for us that showed the different areas where our citizens are really experiencing challenges in broadband. And the results of that showed that at least 13,000 households in Douglas County are experiencing subpar service. And this really creates an interesting opportunity for us. This is not unique to Douglas County. It's not unique to Colorado. This is a situation that's being experienced across the country. And this ARPA funding, as well as other different types of funding, really recognize this digital divide. And we are on the cusp of being potentially able to access multi-millions of dollars of funds in order to improve services for citizens. And in order for this to take place, this fall, we need to place a ballot question to the citizens. And in order to invest any public dollars, the voters need to opt out and give the county permission in order to invest any public dollars. And that includes accessing grants, And it also includes partnerships with private entities or other public entities. So in the spending category, examples of projects could potentially be to extend fiber optic to subdivisions or near subdivisions. And also that can include extending that fiber optic directly to homes in partnership with private service providers, as well as maybe other municipalities and other agencies. Thank you.
In the area of community and economic investment, the county anticipates reserving $3.1 million. This funding could be applied to a range of community investments, including support for nonprofits, affordable housing, workforce expenditures, or services to seniors. When the county made decisions around the expenditure of CARES Act funding, a significant portion of those federal dollars were directed to the assistance of small businesses and restaurants. This funding is anticipated to be applied in different ways. Jen, can you speak a little bit about homelessness?
Yes, hello. My name is Jennifer Eby, and in terms of homelessness, just wanted to share with you that every January we do a point-in-time survey of homelessness. And just to share some of that data, between 2019 and 2020, we experienced a 21% increase in homeless population. And then between 2020 and 2022, the increase was 43%. Granted, those percentage increases are still based on low numbers. In 2022, our point-in-time count was 72. So we are considering, though, with those increasing percentages, we want to be proactive in our approach and keep those numbers low. So on average, another item to share, on average, our law enforcement across all of the Douglas County jurisdictions are receiving over 100 calls per month for services regarding homelessness. So through the Homeless Initiative, which was started with the board's approval in July of 2022, we really value and welcome input from everyone within our community. We started meeting last August, and we have more than 60 representatives from municipalities, law enforcement, nonprofits, and our faith-based partners. We're trying to understand this issue and be proactive with solutions that are the right fit for Douglas County. So we've centered on working to get together under the 4 C's: compassion, code enforcement, community services, and communication. And under the ARPA priority, the commissioners have identified funding to be made available for emergency programs or services. So that is that one. And I will jump into the intellectual and developmental disabilities category now. So under that category, the county has conducted a community survey that was conducted in 2021, really to understand the needs of our vulnerable population. And we did a focus area with that 2021 survey for households that had someone with an intellectual or developmental disability. So I'm going to refer to that as IDD. We had 112 responses to that survey from that focus area. And one of the questions we asked them was, what top improvements are the most needed for a person with IDD? And by quite a large margin, affordable housing was the number one. Number 2 was employment assistance, and number 3 was respite. So this year, the board has embarked on a listening tour with both providers and families, families of those with an IDD person, to better understand their needs. And through this, we met just many wonderful people with just hearts of gold, and the parents and providers who are really dedicated to providing them with the best possible care. That listening tour has really reiterated some of those same issues that came up during that survey. And a common story that we've heard is that parents and families in our community really choose to take care of their disabled loved ones, and they work really hard to navigate a very complicated system to ensure that their son or daughter or their family member has access to the services they need. But as they age, they are increasingly worried about the care that their loved one is going to receive when they're no longer there to provide it. So their answer to this was the need for that independent, affordable housing with supportive services. So in this category, in response to that, the commissioners have identified funding to be available to address housing, respite, day programs, employment, and transportation. I will pass it off to Laura.
Thank you. Hi, everyone. I'm Laura Cinconi. I coordinate the Douglas County Mental Health Initiative. Prior to the pandemic, mental health was certainly a nationwide issue and actually worldwide as a leading cause of disability. It's no different in the United States. But it should come as no surprise that mental health has been flung into the forefront as a result of the pandemic because of how connected it is to so many different parts of our lives. Routine, social cohesion, and connection with others, increases in isolation due to the pandemic, use of substances to cope with stress and uncertainty, disruptions to our routines. So it has definitely heightened over the last couple of years. The board is considering a number of strategies for mental and behavioral health informed by community voice, data, and the Douglas County Mental Health Initiative, of which we have over 40 partner agencies represented. Importantly, through a recent community health assessment and public health improvement plan process, the county gained really good information about the state of health here in Douglas County. Residents who participated in that process identified mental and behavioral health as the worst problem in Douglas County. There were two others that made the top 10. Suicide ranked as the 5th worst problem, and substance use and overdose as the 9th. Ultimately, mental health and behavioral health were chosen as one of the top three priorities for the new public health department to address. So to give you a sense of some of the data in that assessment, the hospitalization rate for 100,000 residents involving mental health issues was the leading cause of hospitalization in Douglas County and was increasing between 2015 and 2019, which indicates a high utilization of hospitals for mental health crises when there are other settings and other programs that could efficiently address those needs. Drug overdose deaths reached a 5-year high in Douglas County in 2020. Mental health distress for both youth and adults has been on the rise since 2013. And all that's to say that Douglas County does have good resources and assets to lean on, including the Mental Health Initiative, and also opportunities to advance additional programming with funding through ARPA and other sources. The ARPA proposals for mental and behavioral health suggest expanding the programs that the county and mental health initiative partners have created that have demonstrated success, are addressing known gaps, and creating alternatives to emergency department and first responder utilization in mental and behavioral health emergencies, creating new service options where Douglas County currently has none, enhancing the network of care for priority populations, meaning populations with higher rates of isolation, mental health disorders, and substance use disorders, and providing opportunities for local agencies and nonprofits to advance suicide prevention. And I'm happy to answer any questions for anyone interested in the specifics of those various proposal areas. Thanks.
In the area of water and wastewater, the county has devoted significant time to investigating potential investments, and that process will continue in conjunction with water and wastewater district partners. The county is proposing to set aside half of its allocation, $34.3 million, for water and wastewater services, which could include funding projects that bring additional renewable water to the county from the South Platte River, projects that extend wastewater service to Sedalia and Luviers, and some support for small water and wastewater projects. Mike, can you speak about wildfire suppression?
Thanks, Dan. Mike Alexander. I'm the Emergency Services Manager within the Office of Emergency Management here for Douglas County. We, as a country, as a state, as a county, certainly face a wildfire problem. Wildfire is the #1 natural hazard in Douglas County, and we know that about 82% of Douglas County residents live within what we call the wildland urban interface, areas that are at risk of wildfire danger. We also know that we've seen a 61% increase in fire frequency since 2006. Fire seasons are more active and longer lasting. Within that 82% of wildland urban interface within Douglas County, we know that we have about $58 billion worth of actual property value that is potentially at risk from these fires. We know from our neighbors that these fires can be catastrophic and result in catastrophic losses. So with those factors in mind, we really have two objectives for our wildfire suppression aviation program: save lives and protect property. And that really is what it comes down to, those two simple things. Not so simple to actually implement. And with the funding allocated here within the ARPA delineation, what we're establishing to do is support our HeliTAC program and increase staffing and logistical and operational supplies for that unit so that we're able to more effectively combine aviation and ground resources to put fires out quickly, small, with the least amount of impact to property and lives.
Well, thanks so much, Mike, and the rest of the panelists for giving us those overviews of our categories. Before we go to a phone question with Roger, we do want to go ahead and remind everybody, if you're joining us on the phone, please press *3 on your keypad if you would like to ask a question. And so, Roger, do I understand we have a phone question to go?
It looks
We
like
do,
before,
Commissioner. Let's hear
Roger,
first
before
from
phone questions, we might have skipped over our hearing room questions. And I always want to honor the people that come down and take their time to be with us in person. I do see a number of distinguished guests here with us. So let's at least take 2 hearing room questions for those in the room, and then maybe we can move to the online and phone. So who here with us has comments or questions for our panelists? Dr. Fuji, thank you for being with us.
So, thank you for having me. Stephanie Fuji. I have the honor and pleasure of serving as the president for Arapahoe Community College. I'm also a resident of Douglas County. So my question is, if you could share with us how the county is using ARPA funds to address workforce needs as a part of community and economic investment.
Thank you, Dr. Fuji. Who would like to take that? You know, just as one of the panelists, I will share with you that, again, American Rescue Plan Act funds are intended for recovery from the pandemic. And my perspective is that workforce and education collaboration with entities like ACC are critically important to ensure that we have a strong recovery and significant employment base that serves Douglas County. I don't know if anybody else on the panel wanted to speak, or Holly, yes.
Thank you for that question. During the pandemic, all of us experienced hardships with our internet just because it was, we were using technology and forms of technology that we've never used before. So whether our children were learning remotely or whether we were trying to take classes online through ACC or other educational institutions, or we were trying to complete work from home, many of us found that there is a digital divide here in Douglas County. And so if you are rural or even in some of the suburban areas here, there were definitely challenges with trying to complete all those tasks and things that we really needed to do from home at the time. So the investment of ARPA dollars could potentially help with workforce and with education because it could be used to leverage some of these really large grants that we could potentially go after. So those multi-millions of dollars that I was mentioning would really help the county be able to extend service, more reliable service, faster speeds to homes so that they could participate in educational opportunities from home and continue to do their work. So many of the upcoming grants that are going to be available that we could potentially apply for do require a match, so 25 to 30%, and that's what those ARPA dollars could potentially be leveraged to do. Thank you.
Thanks, Holly, for that. And I want to encourage my board to continue to look at your particular proposal. I know that we're continuing to solicit input from the public and issues around that phase two with the collaboration. If Dr. Fuji, yes.
And I just can't help myself, so forgive me, but I will share with you. So I've been in the state for about almost a year. And so when they had the initial release of funds, I, like you, Commissioner Till, had some concerns regarding what it might do regarding inflation. In my previous system, which served the Phoenix metropolitan area, the release of funds occurred to the county and to the colleges, and we did not release those funds. And what I can tell you, what I have seen at ACC, we have released those funds directly to students in a variety of ways, whether it's through scholarships, whether it's through our programs, whether it's through technology, broadband support, and support services. And so I really, and I will follow up for sure, but what I can guarantee you is out of the buckets that you have there, ACC delivers on 4 of those in very, very direct ways of addressing. And we are committed to giving you a yield. So we're not just going to talk about nice ideas, but we understand the ARPA investment. We were fortunate enough to get 3.5 from Arapahoe County. And so we are very confident that if you will entertain our proposal, that we can deliver on it in meaningful ways for the residents of Douglas County.
Thank you, Dr. Fuji. I'll just say, I think it's very persuasive to me. I hope I have another vote here on the board at some point. Do we have another question here in the room? Yes, sir.
Hi, good afternoon. My name is Pete Smith. I live in Keene Ranch. My first question, I want to do another one later, but we can go on, is mental health. So if somebody has a mental health crisis in Castle Rock, let's say, and they end up at the hospital, at Centura Hospital, what would happen to them? And then if we do your proposal, what would change about that?
So right now, if someone self-admits to the emergency department or is taken to the hospital on a 72-hour mental health hold for evaluation, it depends kind of their level of acuity, what would happen. Very frequently, there is not reason to hold the individual in the emergency department, so they're released with a list of resources that they could follow up with once they leave. Whether or not that happens is a whole other conversation. And on a mental health hold, they might go to an inpatient facility if their level of need requires that. But they could also be released back into the community and home as well. So it could go one of two ways: back to the community with some sort of self-responsibility for reaching out to services, or higher levels of care where they would receive treatment. One of our proposals under the mental and behavioral health umbrella is to establish a walk-in crisis center and crisis stabilization unit in Douglas County, which does not currently exist. For anyone in this county to access that service, you must drive to Arapahoe County to get that. And if you want a youth-specific crisis stabilization, you'll need to go to Aurora or the Springs to access that. So that is one of those proposals that would bring services into the county that doesn't currently exist. And we're also proposing going beyond that and creating a networked system of care for people who utilize the walk-in crisis center and crisis stabilization unit after they leave. So they're wrapped in services. And we're not expecting that following a crisis, people will follow through on their own in a system that's very complicated. So we want to set people up for success.
Great. Do you want to wait to the second question for later?
You have another question?
Yeah, it's about broadband this time. So in the document I got that shows the level of funding for each of the things, it also has a comment here. There's a significant funding from other federal programs for broadband. Is that funding that's through the state? Is that what you're referring to?
I'm not sure where you're reading that from, but yes.
This was actually in an email that Laura sent around, which just showed the funding discussion, and it shows $8 million for broadband, but then it says there is significant funding from other federal programs for broadband.
So those are the IIJA and a couple other grant opportunities that do get funneled down to the state and then do get subgranted to the county. So that's a competitive grant process that the state is actually the grantee from the federal government. So
Okay.
yes.
So as you know, I'm involved in this process, and I will just say this: I've had 3 different engagements with the state on funding for broadband in Douglas County. In each of those cases, one of the answers I got back was Douglas County is too rich. They're looking to put that money in other places. So if you're thinking that you're going to get more money from the state, and you can talk to the people at Grandview Estates who have been turned down a couple of times now, if you're thinking you're going to, that money from the state is going to end up in Douglas County, I think actually there's a bias from the Denver-based folks against Douglas County for that kind of funding. Just a comment.
Thanks, Mr. Smith, for that. Yes, Laura.
I would just like to add, Pete, you asked a first question about mental health, and hopefully someone would not go directly to Castle Rock Adventist Hospital. They would call their local law enforcement for help if they're having a mental health crisis. Douglas County now has 5 community response teams, and that is a specially trained law enforcement officer paired with a PhD level clinician. And so when there is a call for a mental health crisis situation, this team will respond. And I've ridden with 2 of these teams, and it's amazing how they go on scene, they calm the situation down, they can treat on scene. Or I was with one individual who was transported to an inpatient facility and kept overnight. So we've got 5 of those teams now. We've got 2 for students, or 4 and 1 for students. Okay, so we have 4 teams for the public. We have 1 dedicated just to students in schools, and a second team for students will be up and running. We've got that funding lined up. We're just getting it set up. So hopefully more people are using the community response teams so we can keep people from going to the hospital, because hospitals aren't set up for mental health crises. I just wanted to add that, Pete. Thank you.
Commissioner Till, you had some phone questions?
Well, I'm glad we took those ones in the room here. But Roger, I understand we got some phone questions.
We do. Let's start with Jim. Jim, you're live. Go ahead.
Good evening, and thank you very much. My name is Jim. I live in Highlands Ranch. I'm 80 years old, and I'm really focused on the wildfire issues we're having here, not only in Colorado, not only in Douglas County, but in the whole 11 western states. And I'm curious, and I guess there's not an answer to this right now, but with what's happened down in Colorado Springs, Black Forest, and now more recently up in Boulder County, what are we doing to mitigate fire in places like where I live in Highlands Ranch, where the houses have been built very, very close to each other, where there's wooden fences between the houses that were part of the reason that's part of the reason why the fire went through Boulder County so fast, and we have a issue that, and going back to the issue, I think it's more of a regional issue than it is a state issue, than it is a county issue, than it is a Highlands Ranch issue. Are we Douglas County working on a local issue? Or are we working on as a local issue, or as a issue that's a broad U.S. based issue? I don't think that. I'm wondering if this area, with the droughts we're having, with the fires we're having, with the economic impacts of all that kind of stuff, the fact that we handled the pandemic so poorly, is this area going to be able to sustain the kind of life that we have here today, 50, 80, 100 years from now?
Sir, what a great question. And I'm going to ask Mike Alexander to address part of this, but I'll just say that after the Chat Ridge 2 fire, many of the commissioners were out with the Red Cross handing out waters at Mountain Vista to individuals that had been displaced from their homes, and recognizing that so much of our open space and open areas abut really high-end residential and just typical residential neighborhoods in Highlands Ranch and throughout our county. There's a real recognition of the potential damage to our county. I believe every square mile of property in Douglas County represents about $110 million. We're talking about a helitech program of $1,342,800 through 2023, as well as a mitigation program of $2,323,000 400 through 2023. The mitigation program is a concept around individuals that might be land rich but potentially cash poor or cash challenged, and encouraging them to mitigate their land. The county is talking about providing a 25%, 75% help if they do 25% of that effort in mitigating their lands. That encourages reducing the potential kindling on land that can impact our entire county. And let me turn it to Mike on the Helitack program.
Thanks, Commissioner. We are focused here on one aspect of answering the wildfire problem in relation to our wildfire aviation program. We are a very unique program. There's no other county in Colorado that's doing more to answer that side of the problem in terms of response and getting to fires quickly, putting them out fast, and making sure that we're doing everything that we can to reduce that impact to our citizens. We are the only county in Colorado that's doing that, and upstaffing and creating this nationally recognized and certified program that we're able to do that. Now, I would also say that our Helitack program and wildfire response is really just one piece of that overall puzzle when it comes to the wildfire problem. And the other part that we're doing, one of the other things is the wildfire initiative that Commissioner Layden leads. And that's one of these groups that we're working together on a collaborative basis through partnerships at the local, regional, and even with federal, national level, in how we answer this problem, how we get to mitigation, response, and all the different facets that are included with wildfire in order to solve that problem. I can tell you in my position and within the Office of Emergency Management, we're talking about wildfires every day, how we answer that, how we mitigate, how we respond, how we prepare for the future. And it's something at the forefront of our operation.
All right. Well, thanks, Mike. And hey, by the way, I want to take a second. Yesterday, the town of Castle Rock had their State of the Town presentation. And before the mayor started up and everything, Mike, I wanted to let you know I had an opportunity to talk to actually my old neighbor, Chief Norris Kroom, fire chief for town of Castle Rock. He was very complimentary and also very gracious for the help that the Helitack team gave to Castle Rock last week. So good job. Please let the team know they did great. Roger, I think we got another phone question ready to go.
We sure do. Let's hear from Robin next. Go ahead.
Hi, good evening, everyone.
Evening.
My biggest question is about the broadband or the internet. We were down most of the day here in Parker. We're incorporated, we're, within a town, and yet, my husband's company keeps them home 2 days a week, and the 3 days a week they're in the office to help with keep COVID down. We're fully vaccinated, all that good stuff. But most of the day was spent putting the house back up each time we went down. And we couldn't figure out why, because everything was fine earlier in the morning. All of a sudden, down. All of a sudden, low levels. We even tried to put the house back up again, take it back down, put it up, take it down. I'm really getting tired of this because in the unincorporated areas, which we bump right into unincorporated before it becomes Lone Tree, if we're going west, and I live on the most western part of Parker, across from the Lutheran High School, and there is no in the infrastructure going in, whether it was in the newer parts that already have homes or the new parts that are getting infrastructure put in so they can put homes in along Ridgegate, any new antennas at all. We have not had anything put in new since we got here to Parker in '98. And we really feel that somebody needs to get it moving so that we don't have to be without it, so that kids studying in the area don't have to be without it, and that people who work part-time from home and part-time from work can work from home when they need to and get their work done.
Okay, thank you so much, ma'am. Holly, we had a work session where we were kind of talking about our approach, our strategy for using probably these ARPA dollars in the broadband space. I wonder if you could speak briefly to that and perhaps address this our residents' concern that she expressed.
Yeah, the first issue being within the town of Parker, they have actually already opted out, and citizens have given express consent for Parker to use public funds to make broadband improvements. So the first thing that I would suggest is that you reach out to your municipality and your representatives there and that you talk to them about the issues that you're having. This is not an uncommon story that we hear, whether it's in a municipality or whether it's in rural areas. There are challenges across multiple different areas, and there's a lot of different options for improving that service. But it really kind of depends on the area. So I wouldn't want to speak to your specific area there in Parker, but there are some opportunities with the county that if we are able to have a successful ballot initiative come this fall, that we would be able to partner potentially with some of the municipalities and to work with them to leverage funding and to make improvements into municipalities as well as unincorporated areas. So there are about half of the subdivisions in the unincorporated areas that are underserved or unserved when it comes to broadband, and easily that many in the municipalities. So a lot of opportunities for partnership.
Awesome. Thank you so much, Holly. And thank you, ma'am, for that for letting us know your situation. Now, before I turn it over to Commissioner Thomas, I just want to let everybody on the phone know and remind you that press *3 on your keypad if you would like to ask a question. And you can also participate online at douglas.co.us/town hall. Let's take some more questions. Commissioner Thomas, why don't you take it from here?
Thank you. I believe Roger has an online call for us.
I sure do. Beth submitted a question, and here it is. She asked, some projects sound like long-term investments. Isn't this one-time money?
Could you say that again, Roger? I'm not sure we heard all of it.
Sure. Beth asked, some projects sound like longer-term investments. Isn't this one-time money we're talking about?
So that is correct. Dan, were you going to answer that question?
I can certainly take a portion of it. The American Rescue Plan Act authorizes the county to obligate the funds by 2024 and complete expenditure of the funds by 2026. We anticipate that many of the expenditures that we've been talking about tonight here are one-time investments. Some of these are pilot programs that will lead to future opportunities. And we anticipate spending time over the next several years to assess those programs, determine what works and what doesn't, and determine funding strategies going forward.
I'll jump in on that one too, because that's actually been a real topic of conversation among the commissioners that I think I appreciate Dan taking that, because I know we have sweated him down on several of these projects in terms of, is there a long-term component? And I know Laura Cinconi, you've been put on the hot seat with a couple of projects, and Jen, you as well. So it is something we're focused on. That very question has come up several times in the discussions with the commissioners.
Roger, I understand you have a phone question now. Is that right?
That's correct. Let's go to Inodio next. Go ahead.
Aloha. Good evening. My question is regarding the rural area for broadband. I'm just concerned that the priorities are given to subdivisions, and you guys forget about the rural areas. We're having, in fact, where I live in Parker, I'm about 4 miles away from downtown. I don't have good cell coverage, and I don't have any broadband. So we have to go to satellite, which is really, really unreliable. And we have to have a hard line in order to communicate. So that is my concern is what are the priorities with broadband?
So there is one project opportunity that's called Middle Mile, and there are sizable grants that are available to this. It's a very expensive endeavor, and so it's really important that we leverage our funds with other partnerships and other grant opportunities. But this Middle Mile is basically the backbone of the fiber that is extended through an area before it actually goes to your home, and that's the largest portion of the cost of providing that broadband to you. And one of the requirements for some of these grants or actually all of the grants, is that it is fiber optic. So it actually has to be a wire line. And that is one of the opportunities that is before the commissioners that they have to consider, is potentially going after these grants for these middle mile projects, which would bring that fiber optic so much closer to your home, and then would only require that last step of extending it to your home. There's also opportunities for grants in different categories for that last mile of extending it from the middle mile to your home as well. So a lot of grant opportunities, a lot of leveraging opportunities, and there's certainly a lot of areas that do need attention, and we have heard from citizens. So we will be working on what that might look like, and the commissioners will be prioritizing what those areas also might look like, and we'll need to see what happens this fall with the ballot initiative, which would allow us to move forward with that.
Thank you, Holly. Roger, is it time for the polling?
You bet. Thank you, Commissioner. It's easy to participate. All you have to do is use your telephone keypad to enter the number of your response. If you are participating online, just click your response. And for those of you in the room, we are passing out paper copies now. So here's our polling question. Of the investment categories we've selected, which one is most important to you? Press 1 for broadband, press 2 for community and economic investments, press 3 for homelessness, press 4 for mental health, press 5 for services for individuals with intellectual and developmental disabilities, press 6 for water and wastewater, and press 7 for wildlife mitigation and suppression. I'm going to quickly repeat those again. 1 is broadband, 2 is community and economic investments, 3 is homelessness, 4 mental health, 5 services for individuals with disabilities, 6 for water and wastewater, and 7 for wildfire mitigation and suppression. Go ahead and enter your selection now. We'll report the results after we take a few more questions, and that's back to you, Commissioner Layden.
Great, thanks so much. Let's check here. Do we have any additional hearing room questions or questions online? Any questions in the room? Okay. Let me make sure you have a mic.
So this could be more commentary, actually. I like the question that we had on the call about the sustainability of implementing and spending these funds. And I think that it's really key that with that budget that we stay on track, because the minute you hire someone, the minute you resurrect something, the minute you have sustainability, whether it's pallet houses, whether it's medical. So I just wanted to make that point and see if you guys had something you were discussing now or planning in that strategy in that budget.
Thank you for that. Who would like to take that?
I'll jump into that a little bit. And so we do have some pilot programs, but then we do have some cases where we've expanded headcount. You know, we heard from Mike about expanding the Helitac teams. The wisdom of using one-time dollars to expand the team that will be likely ongoing is probably questionable if it's not for the fact that we know that the constant fire danger that we all live in here on the Front Range. It's the weather. It is something that will always be present. We live in a semi-arid area, and if anybody could have taken a bet that, you know, a sizable portion of Boulder County was going to burn down at the end of December last year, I'm not sure anybody was going to take that bet, and yet it happened. We know it happened. So that's a case where we actually probably are making this investment with one-time funds, and there is going to be follow-on cost moving forward. I feel pretty good about committing to that because it goes right to public safety. Another instance, and it was mentioned a little earlier, is one of the things we're considering is expanding our clinical response teams. Those teams where a clinician is paired up directly with a member of the police forces and our sheriff's deputies. Again, we're using one-time funds to expand those teams, and there will very likely be ongoing cost for those teams. Me personally, it's public safety. I'm willing to make that investment. I'm willing to do the work to make sure that that's something we can sustain. Well, it's, I don't think everybody saw your gesture of where's the money coming from. You know what? Here in Douglas County, I think we've proven time and time again, we're willing to make the investment in public safety. We're willing to find those funds as needed to make sure that we keep our community safe. As far as some of the other programs, you know, I'm racking my brain. I'm kind of looking at the list of the things that we're looking at here, and I'm having a hard time finding something that we would make an investment in where we do have those long-term commitments. But no, your question is very salient and goes exactly to the analysis that we're doing. So said the comment was every one of those will need to be sustained. Not all of them. Actually, no, not all of them, because they're efforts with partners, and the partners are actually the ones that are going to pick up that long-term commitment. We're providing seed money so that a partner in the community, be they ACC, be they Louviers Water and Sanitation, be they a private company that we're partnering with in the broadband space, those are going to be their long-term costs. That's the goal that we're going for, but it's definitely something, I appreciate the question because it's something we got to keep an eye on. I'm going to segue. Roger, do we have another phone question?
We sure do, Commissioner. Let's hear next from James. James, go ahead. All right, let's try Wilma. Wilma, are you there?
I am here. Thank you for taking my information. About Verizon, I was having trouble with getting coverage here during the day because I live in the Morningview neighborhood. We have a big hill east of us. We have a big hill west of us. And so I was in Verizon complaining, and they said they are, by Christmas time, they're going to put up, I don't remember the figure, but it was in the thousands of new transmission poles.
Thank you, ma'am. So, oh, go ahead, ma'am. If you got more, keep going.
No.
Okay.
No,
Hey,
I thought that you had.
okay, thank you very much. Hey, Holly, I wonder if we can take a moment because it did sound like the resident we were just hearing from is really talking about cell phone technology. How is cell phone technology, cell phone connectedness here in the county different than what we're contemplating with broadband? I wonder if you could help us out with that.
Yeah. So cell phone coverage is actually completely separate from this topic. So when we're talking about broadband, we're talking about internet, and we're talking about specifically wireline, so fiber optic being put in the ground and sent to your home. So these grants do not cover any cell coverage. They don't anticipate creating antennas or anything along those lines. It's really about internet, faster internet, more reliable speeds to your home. So completely separate topic.
Thank you. Is there another phone question, Roger?
We do have another. Pamela, it is your turn. Go ahead.
Hi, I was wondering, I live in the Meadows by Castleview High School, and I was wondering if that is included in upping the broadband speed. And I was going to ask about cell towers as well, but I just heard that that is not in the plans.
You said you were in the Meadows, is that correct?
Yeah, by Castleview High School.
Okay, so you're actually within the town of Castle Rock, and you're in an incorporated area. And Castle Rock has not opted out of the law that prohibits them from investing public dollars in broadband improvements at this time. So I would suggest that you reach out to your representatives. But as I mentioned, if the county is able to go through with a successful ballot initiative this fall, as is Castle Rock, then that would be an opportunity for us to partner and consider options for improving broadband in your area.
Well, it looks like we're getting pretty close to the end of our time. And so I believe all of the commissioners will wrap up and first begin with just a significant thanks to everybody in person and online that have chosen to be with us this evening and ask their questions and listen in. I believe it's our 67th live town hall. I was corrected because we had to add all the COVID live town halls. So we're now at 67. I can't believe it. But thank you all for being with us. You know, ARPA is really important because I think it's been a great community conversation driven by public input, citizen comment, and we're continuing to shape and refine these buckets of potential funding based upon your input. So what you provided to us tonight and throughout this lengthy process has been greatly appreciated. I just want to harken back to some of the comments around, you know, what about ongoing programming where it's not one-time funding? What is this going to look like for us? Keep in mind, people come to Douglas County because it's safe, it's a clean, it's a very robust community. Oftentimes we're rated the healthiest county in the state, if not the nation, and there's a reason for that. So our investments, particularly in wildfire mitigation, public safety, things like homelessness, if people come to Douglas County and we're near functional zero on homelessness, that means your property values will probably go up and the county will continue to benefit from that, as will its citizens. So I'm excited to continue this conversation. But again, thank you so much for being with us tonight. Commissioner Teal?
Hey, thank you. I appreciate it. Well, thanks for everybody for coming out. I mean, this is a big topic. You'll all harken back to my preamble on how dubious I was for this money to come in, for this money actually for Congress to spend this money in our entire country. And I hope you get the impression that, you know, your commissioners and the staff here at the county, we really are working to spend this money wisely. We are keeping an eye on the one-time dollar investment and making sure that, yeah, it doesn't turn into an ongoing anchor around our necks. And so we're trying to avoid fads. We're trying to avoid what might be the good, quick idea and do that long analysis. Try to work with all you guys, hear from all you guys, and come up with lasting, really generational solutions that can take us through, I don't know, $5, you know, a gallon gas. Is it just this year? Is it the next 10 years? Is it the next 20 years? What we're trying to do is come up with solutions to use this money that will provide solutions for the next 20 years. Thank you all for coming out. Commissioner Thomas, why don't you take us out?
Thank you, Commissioner Teal. I'd like to thank everybody in the room who came, people online. I'd also like to thank our amazing staff who are in the back, who were here early trying to make sure that all the technology works so we could hear and you could all hear and we could all talk with each other. So staff, thank you for being here and what you do. You too, Roger, they're up on the line in the sky. You know, what I heard is people asking questions about mental health services, about broadband, about accountability with our tax dollars. And I believe this board is going to fund all of those things in a responsible manner. There is one water project involving Parker Water and the Platte Valley Water Partnership. I think that's a project that can bring water to Douglas County by 2035 and will affect over 100,000 residents in Douglas County. So that's the kind of legacy investment that I'm interested in partnering with. So thank you everyone for being involved. Stay tuned and God bless everybody.
All right. Thank you, commissioners. On behalf of Douglas County, thank you for joining us this evening. If we did not get to your question, we invite you to submit any question you have about any topic whatsoever at douglas.co.us/Citizen Connect. We hope you will join us again for future town halls, and we wish you a very good evening.